I'm Dr. Mugdha Raut. I'm a practicing obstetrician and gynecologist since the last 31 years. I'm a co-founder and a partner of Dr. Raut's Center for Reproductive Immunology, which I started with my husband, Dr. Mohan Raut. From the time we took our postgraduate training in obstetrics and gynecology, we were very interested in the field of repeated pregnancy loss, recurrent IVF failures, and unexplained infertility.
Hello, I am Dr. Mohan Raut. I am a practicing gynecologist for last 33 years and partner of Dr. Raut's Center for Reproductive Immunology. Whenever we used to treat couples with repeated miscarriages, recurrent IVF failures or infertility, we used to be really disturbed because in almost 50% of these couples, we could not find the cause and they were labeled as unexplained and very difficult to treat. And it is at this stage that we were introduced to reproductive immunology by our teacher Dr. Usha Krishna through an international research project from Oxford. This project was about role of lymphocyte immunization therapy in repeated miscarriages. And it is in this field of reproductive immunology that we found solution to the problems of these unfortunate couples. And it is now known that lymphocyte immunization therapy and other immunomodulatory medications have beneficial role in the treatment of these couples with repeated miscarriages, IVF failures and unexplained infertility.
So many patients, those whom we have referred to you, more than 90% of the patients were positive in first attempt of embryo transfers. So that was very encouraging for us also, and that made me trust on the immunological causes, that these causes, which there are some studies who don't support it, it's not like that. Because our clinical experience says, yes, we have been benefited by immunotherapy. So we cannot ignore this fact.
Reproductive immunology plays a very important role in normal pregnancy. It is not only important for the implantation process, but it also plays a crucial role in the growth of pregnancy. Now, whenever a pregnancy is formed, 50% is from mother and 50% is from father. The part which comes from father is totally different to mother's body. So, the pregnancy is 50% different from mother's body. So, logically speaking, there should be a reaction against pregnancy because pregnancy is 50% different. But this doesn't happen and pregnancy continues without any problem. And this is indeed a miracle of nature, and it is also called as paradox of pregnancy.
This further led to the idea of a dedicated reproductive immunology center to provide these treatments. So on 8th December 2013, we launched our center, Dr. Raut's Center for Reproductive Immunology in Mumbai. It was inaugurated by Dr. O.B. Christensen from Denmark, who was the secretary of the European Society of Reproductive Immunology. The center was started with a clear vision to help the couples with repeated pregnancy loss, recurrent implantation failure and infertility. The process of LIT is there for many years. We have modified the process so that it is required to be done only once. We have also improved the efficacy of the process by selecting the right count of lymphocytes. Due to this, we have achieved a success of 80 to 85%. We get patients from across India for LIT treatment. Patients not only from India, but from various countries like Ireland, US, UK, Australia, Germany, Poland, Saudi Arabia, Singapore, Bangladesh, Sri Lanka have been benefited here with LIT treatment, and this is because of efficacy, single sitting, cost and our international accreditations.
Are continuing and quite a few of them have had their children. So let me start with IVF failure. Now, people think IVF is the be all and end all of every infertility treatment, whether it is unexplained infertility or whatever. So I had this patient, a very close friend's relative. So somebody, I have known that family from childhood. So they have been married for 12 years. No, unexplained infertility, literally technically unexplained infertility, natural cycles, IUI, everything failed. She's 32 years old now, early marriage. And she comes to me in June, Didi, I have conceived. And I'm like, what? She's like, yeah. And I just saw her yesterday. She is 22 weeks. Everything is perfect. No complications, nothing at all.
The immunological protection to pregnancy may not happen in all women, and in these cases there is an immunological rejection of pregnancy, and this leads to either repeated miscarriages, recurrent IVF failures, or unexplained infertility. And it is in these couples that immunomodulation using lymphocyte immunization therapy and other immunomodulatory medications is useful. There are many studies conducted which have proved the efficacy of lymphocyte immunization therapy. There is a large study which has even proved the safety of lymphocyte immunization therapy. And the lymphocyte immunization therapy method that we use at our center is also unique and a patented process.
Our vision is providing compassionate fertility care, spearheading innovation and research with specialists in the field, pursuing standards that set benchmarks in the industry, and partnering with experts to offer our patients best solutions towards successful parenthood.
To fulfill our vision, we have our mission. We have made our life's work the mission to help couples become successful parents. We dedicate ourselves to necessary research and innovation to follow our vision. We are committed to creating a strong ecosystem and building capabilities within the industry for our vision. The lymphocyte immunization therapy process that we use at our center is patented and copyrighted. And because of this specialized procedure, we do this as a single sitting process for 3 hours, unlike multiple sittings that are required for centers abroad. Lymphocyte immunization therapy experience that we have at our centers, we have shared it at international conferences, and even we have published papers in international journals. Currently, we are writing a book on this subject, Role of Lymphocyte Immunization Therapy in Reproductive Failure, with Springer Publications, Germany. I would like to share an interesting case, a patient with a history of 15 miscarriages. This was a couple from Ireland, and she had 8 spontaneous pregnancies and followed by miscarriages. Subsequently, she underwent 8 times IVF, of which 7 times she conceived and she had miscarriage. So totally 15 miscarriages. She came to know about our center through internet. She sent us an email, and subsequently she came to our center. She was investigated here and was given lymphocyte immunization therapy, and afterwards she conceived spontaneously and was blessed with a baby boy. It was really a difficult case to treat, but we were really happy that we could help this couple overcome their problem of 15 miscarriages using lymphocyte immunization therapy at our center.
We are married for 14 years. Since then we were trying for a baby. But unfortunately, every time I got pregnant, I was miscarried at around 8 to 10 weeks of my pregnancies. We had lots of investigations and treatment in India and UK. And thank God I was able to find out Dr. Raut's website, and I contacted him by phone, and he advised me to send all my details to him by email. So I had my lymphocyte immunization therapy treatment in Dr. Raut's help. During my treatment, Dr. Raut, immunologist, and Dr. Mukta Raut stayed with me. It was very supportive and very helpful. Thank goodness I got pregnant after 2 months, and the pregnancy went to full term without any other complications, and I delivered a baby boy without any problems, healthy baby boy.
I remember a patient who had 7 IVF failures. The couple was advised surrogacy. However, they wanted to take one last chance. So they were referred for lymphocyte immunization therapy or LIT. The couple decided to undergo immunotherapy at our center, that is Dr. Raut's Center for Reproductive Immunology. 6 weeks later, the wife underwent embryo transfer. the couple conceived in the first cycle after immunotherapy, and they went on to deliver twins who are now 2 years old. The time, money, emotional and physical anguish which such couples undergo can be avoided by this small intervention early on in their life. The difference was seen by Dr. Kshitij Murdia, who is one of the founder of Indira IVF, India's largest chain of IVF centers.
My experience, Dr. Mohan, is fabulous, I would say, because I remember when I interacted with you a few years back, that was the time I was also very nascent about what reproductive immunology could do to a patient. And then we had these repeated failures who would fail 3 cycles or 4 cycles, and we have done everything for them. And we don't know as to why the patient is not conceiving. And then, I thought maybe I heard some of your talks on immunology, how we should evaluate, and that's when the time, and we have had great results. I think I know.
Help 100,000 couples to fulfill their dream of having their own baby. And in this journey towards our vision, we are more than willing to go an extra mile to help everyone. To make this journey very smooth, we have made all the arrangements for patients not only from all over India but across the world.
There is a very simple, cost-effective and safe 5-step process one has to follow. 1. Book an online appointment for consultation. 2. Get investigations done in your local area. 3. Visit our center in Mumbai for a 3-hour, one-sitting LIT therapy. 4. Online follow-up. And 5. Experience parenthood. What more? We have a tie-up with a travel partner who will take care of all your travel needs in India in addition to the therapy.
So, are you ready to fulfill your dream of parenthood?